Hello ladies, this is Sylvie. I made a little quick in video here and made up a PowerPoint just to kind of show you the medications that you would prescribe for explant surgery. So I would love to go over them so kind of ease your nerves for your upcoming surgery. I do understand. I pretty much been in your shoes. I do get it. Just a little rewind. My name is Sylvie. I've been part of the healthcare field as an RN, registered nurse, and later became a mental health provider. So I do want to tell you that you're not alone. I do understand the nervousness, maybe a question mark on, oh my goodness, what kind of medications they're going to give me or what to expect, right? But there are going to be more videos coming up, so look out for them. But right now, let's stick with the medications first, okay? So let's go start with the first medication here. I have an antibiotic, which is a name for cephalexin. The drug class for this antibiotic is cephalosporins. So basically, they'll give you a prescription that they're going to be saying is take one capsule of 100 milligrams by mouth 4 times daily. So the brand name for this antibiotics is called Keflex. So the uses for this, basically, as you know, we're going to be having a surgical incision right under our breast fold. So our area of surgical incision is going to be very prone and exposed to any kinds of any bacteria or anything like that. So we kind of want to prevent that to happen. So this type of antibiotics is for that. So it's for any type of infection from the skin, for example, for maybe bone, ears, UTI. So it's more information I'm giving you guys here so you get an idea of what this one is. And it's also effective and highly useful for treatment for streptococcal and staphylococcus strains of bacteria and this, as far as skin infections go. So the side effects for this antibiotic is any type of GI effects. So that's one of the things that I'm prone to have, a lot of GI side effects and things like that, or maybe I do get also rashes. So as knowing my history, you're the ultimate person that you're going to know if you're going to take it or not take it. So I just, in my case, I did tell you in the previous video on one of my YouTube videos that I did get some side effects. So I did decide to take oregano oil capsules, which I went over that in the other previous video. So it's all up to you, okay? So I do recommend my patients to take it with food. It says either with food or not with food, but I always go with the make sure to have food in your stomach. This is the next one thing that I want to tell you. Most ladies or anybody takes vitamins in the mornings. You know, they say I may need some vitamin D, some vitamin C, whatever vitamins. But just keep in mind one thing is once you take vitamins combined with your any antibiotics, just remember that it will interfere, right? It will interfere with the absorption of antibiotics into your bloodstreams, which this will lead to less effectiveness of the medication. So something to just to keep in mind. It may have some kind of interactions, so just always go to the safe route. Okay, so I always just kind of take it alone and not combine it with anything else. So you may think like, oh, let me take my uh, herbal supplement on the side and things like that. But at the end of the day, you have to be remembering always that if you mix it with something that you may not share, it may interfere. It may either raise the dosage or may lower the dosage or will cause you some kind of adverse effects that you don't want to experience. So always keep that in mind, okay? The next medication is called muscle relaxant. This is a muscle relaxant that is called cyclobenzaprine. This is a 5 milligrams tablets, okay? So you'll be prescribed to take one tablet by mouth every 8 hours, which is a 5 milligram tablet. The brand of this medication is a Flexeril. So this is pretty much helps to improve muscle spasms. It helps to lower pain and also tenderness. This is specifically for, in our case, since they're going to target more in the breast area because the surgical incision is right at the breast. So just remember there are a lot of muscles. Our breasts are basically, there's a lot of lymph nodes, a lot of nerves, and a lot of, you may experience some tightness after when you wake up from explant surgery. You're going to be feeling tightness and muscle spasms. Just remember, we have been through a trauma, right? Of any type of surgery is a type of trauma. So our nerves will be really very, very sensitive, right? So this will help to lower those spasms, those paresthesia, side effects like the electrical shock, the little pins and needles that you may feel. All that is called paresthesia. So that's something that most people, most surgeons, most nurses that work along with the surgeons, they suggest to take the muscle relaxant, mainly at night, just because that way you can sleep better. And always keep in mind this medication, right? That one of the side effects for this medication is sedation. So it makes you what? It makes you sleepy, right? So also makes you drowsiness, lowers blood pressure, also blurred vision. So it's one of those things that you want to keep in mind as well, that you may want to be safe and not take it in the morning or drive, right? Be behind the wheel. It's always good to just take it at night. And if you have pain, for example, mild pain, moderate pain, I would just go with a Tylenol, and just knowing the fact that there's no interactions and you'll be safe, it's okay. Most plastic surgeons may recommend just to take those two at night, so you'll be able to sleep at ease and no problem with no spasms. And that's one thing that I have noticed, that's what they recommend also at my with my plastic surgeon. And I remember just not to take this medication with, for example, if you're taking any antidepressants, or if you possibly taking like a herbal supplement like St. John worts, I would suggest to avoid them. I would suggest to avoid them, okay? Or any drugs or opioids or any other psychotropic medications. Why do I say that? It's because this will help. This would actually lead to an increased levels of serotonin syndrome. This calls it basically raises the serotonin levels, will lead to serotonin syndrome, and which lead to different types of adverse effects that you don't want to experience. For example, shivering. You may feel some muscle rigidity. You will feel like for all of a sudden you're gonna feel insomnia, like increased blood pressure, restlessness, excessive sweating. So, and on top of that, you will feel like confusion. So you don't want to just have any other medications that you may have on the side, any herbals that you take on the side, say homeopathic route. There's no problem for you to do that, but you always have to tell your doctor. You always have to make sure to remember, do not mix any prescribed medications with anything that you else take aside. Because at the end of the day, you don't want to experience any of those adverse effects, and it can actually make things worse, right? So just want to keep that in mind, right? So the next one is called promethazine. What is this one? It's an antihistamine and also antiemetic. This is a very popular medication. This is a 12.5 milligram tablet. So the brand for this medication is Efenergan. You're going to get a prescription that I would say to take one tablet, 12.5 by mouth every 8 hours. So what is this one for? This is to prevent any allergic reactions and anaphylaxis, sorry. This would, like, for anything as far as any reactions of allergic reactions that you may have, like if you have a side effect of like itchiness and sneezing, any signs of that. This is also prescribed for any type of surgical procedures to prevent any nausea and vomiting as well. And anything for reactions, for allergic reactions to blood products like blood transfusions, also that's prescribed. The side effects for this is also it will make you drowsy. It lowers your blood pressure. It causes dry mouth, nervousness, and it's also sedative. So also do not be behind the wheel. And any type of medications, refrain from any alcohol, any type of other recreational drugs or anything like that. So just to keep you that in mind, that you just don't want to mix with anything like that, because if you like I said, it will worsen any type of adverse effects. So also I want to tell you too that Um, just remember that at the end of the day, you want to get into the route of getting healthier and to the healthy route. So just please do not mix any medications just because you are in a hurry or anything like that. There's a reason why they're prescribed the way they are. Okay. All right. So payment. You may wonder, should I take Tylenol? When should I take another pain medication? So Tylenols are usually either made as a regular or max strength. Tylenols are mainly more focused for mild and moderate pain level. So if you're wondering, if you see the pain scale on the bottom, like that's just more like the pain scale that we show to patients to kind of help them guide them through what level of pain they are at the moment. So mild, I would say, would be from like 1 to 5, and moderate would be from like 5 to 7. So it's just kind of give you an idea more or less where you be. So you may wonder, how am I supposed to take them? So if you're going to like the and let's say you can be prescribed, or you be able to keep that in mind, to take either 325 milligrams or 500 milligrams every 3 to 4 hours, or 650 milligrams every 4 to 6 hours, or 1,000 milligrams every 6 hours as needed. I highlighted that part because at the end of the day, you have to really protect your organs, in this case, your GI. You don't want to excessively take it. It could be really toxic for you. And just always remember that the total maximum dose for Tylenol, period, for any healthy human, it says that not to over exceed more than 4,000 milligrams. So this is really good to keep in mind, to not over exceed 4,000 milligrams, okay? And just remember, 4,000 milligrams per day. Any elderly clients, I would say, older than 65, they would tend to give them a lower dose, and because higher dose would be more toxic for them. So I would say 2,500, I would say, no more than that. So another type of pain medication, so the Tylenol, you can pick it up over the counter. So you can buy it at CVS, Walgreens, any drugstore. And Percocet, that's prescribed. This is a controlled substance that needs to be prescribed. So Percocet is basically a combination of oxycodone 5 milligrams plus acetaminophen, which is a Tylenol, of a tablet of 325 milligrams. Because that way you can understand, like, this is a very, very, very strong narcotic. So this is a very, I would say, severely moderate level to moderately, no, sorry, moderately severe to severe level of pain. So this is more like 8 to 10 and level of pain. So that's just something that you either that you are really not able to tolerate your pain. That's something that is prescribed for you, just in case on the side. So it's prescribed as taking 1 tablet by mouth every 6 hours as needed as well. So all this pain medication, you have to take it very, very cautiously, or any medications that are prescribed to you for any type of medical conditions, take it with caution. So you can take this up to 12 days for acute pain. So remember, all these pain medications, they will cause you very, very levels of high levels of constipation. So that's something that is not so pleasant, especially for us having surgical incisions. Once I know as women, we tend to be like very nervous because we're putting a lot of strain and all that. So also something to keep in mind, right? All right, the next slide. Extra services, and there are also things that is optional. So any plastic surgeon will offer you any services that you would buy at the side if you're interested. This is something that is not included in your payment plan or your total payment. So they offer a nerve block, and you're thinking, what is this, right? So this is more like an injection of maybe it's like a numbing medication, and that is applied on a specific nerve to help you reduce that, that level of pain that you may have in a certain areas of the body. So the doctors obviously will be able to apply that. And this, it's an anesthetic and also an anti-inflammatory injection. This is used for pain treatment and also management. And this is usually last of what I hear from most women is 2 to 3 days. I did not take any of these medications, as not even on this extra services either. I have not taken that, but this is what I've heard from other patients as well, and from the women in the group, from Dr. Dev's group. And another thing, also another service that they offer is a banana bag. This is a quite popular IV fluid that is offered, and this is actually popular for any type to alleviate symptoms of a hangover. So this is an IV fluid packed with full vitamins and minerals. You wondering what kind of minerals and vitamins are these? So this is like morphiamine, folic acid, magnesium sulfate. This is pretty much helps to correct those nutritional deficiencies and chemical balance, and also corrects any of the electrolytes imbalances that you may have at the time of the surgery, after surgery. So these are the two services that we offer. And also another medication that will offer you, this is more like homeopathic herb that's called arnica. It's also another option that they will suggest for you to take. And this is specifically to help you alleviate from bruising, inflammation, stiffness, and muscle pain. All I hear is really good, but just keep in mind that this medication, this homeopathic herb, it just remember not to take for those women that may have some kind of thyroid dysfunction. For example, I have thyroid nodules, and there's something that I always have to make sure and always remember to not just take anything because I was prescribed, or I always tell anybody to be more curious on evidence-based research on any medications. Find out more information on what things are prescribed for you. Just don't take anything if they just prescribe without knowing what you're putting in your body. Well, I wish I had that in my mind when I put the implants in, but anyways, that's another story. But just remember that this will fluctuate those TSH levels, thus the thyroid hormone. It fluctuates, and that's something I don't want to mess with, because I need to take care of my thyroid. I have my mother had thyroid cancer, and it's something that I take it really, really serious, and I would suggest for any woman that have any type of thyroid issues or any thyroid history, family history, to do their own research. And also that goes for any other medications that's prescribed to you, not just this one. So this is actually this is more like arnica is really like a yellow flower that is actually a it's grown in a lot of mountains in Europe and also Serbia. It's something that I just kind of read over that, and it's mainly used in any homeopathic practitioners. So they're really there's like evidence that it actually helps with different types of stiffness and muscle pain and bruising and inflammation, like I said. So it's pretty good to know. But I personally have not taken it, and I'm not interested due to the fact of my thyroid, right? And that's what I have for y'all. And I really do hope that this helped you somehow, maybe to lower a little bit of your anxiety or anything like that. So if any questions that you may have, please feel free to contact me. I'm at email mentalhealth.bii@gmail.com. And I do tell my patients, at the end of the day, you are the captain of your own health. So that means that you are in charge of that, right? Of the route or trajectory of your life. And you have the power of knowledge of knowing all these medications, and make sure to please be curious on to finding out more about any medications that are prescribed to you. And please do not feel shy to your doctors or any providers in front of you as far as any medications. We're here for you. And I'm actually personally been on the route of Explant. Today is my 1 month and I believe another week and a half or so. So it's been like, no, actually it's been 5 weeks already. Yeah, it's been a little bit past 5 weeks. So I've been in your shoes. I understand what you're going through, and just remember you're not alone. Okay? You're not alone. I'm glad you stepped by my channel. Please like, share, and subscribe for upcoming videos. And I hope it helped hope it helped you a lot from this video, and I hope to talk to you soon. Bye bye. Have a wonderful day, everybody.